Welcome to Section 2 of Biostatistics. Recall that we think of biostatistics in three arms. You perform the study, then you evaluate the study, and then you apply the study. In this lecture, we are going to discuss performing the study by discussing the different study types. The study designs you can be tested on are listed here. The top four, cross-sectional, cohort, case control, and randomized controlled trials, are the most important. The remaining three, crossover studies, case series, and ecological studies, are also important, but are more likely to present as clever distractors on an exam. Question writers are really clever at making these various types of studies appear very similar to one another in a question stem. In this video, we will not only teach you how to apply knowledge about each study, but also how to discriminate one from another on an exam. Cross-sectional studies are snapshots in time that can determine disease prevalence. However, they cannot determine disease incidence. They can also find correlation. However, they cannot find causation. Furthermore, it does not follow participants over time. Let's say there is a study evaluating the number of apples eaten per week in a given population of 5,000 people. In this study, you can include as many variables as you would like, such as age, ethnicity, location, and amount of water that is taken in each day. Let's say 800 individuals in this sample population eat at least one apple each week. Now let's say you also found a strong correlation between individuals who drink at least 1 liter of water a day and those that eat at least one apple per week. This is a correlation. However, it is not causation. We have no idea why high water intake would be related to weekly apple ingestion. We could form a hypothesis, but cross-sectional studies cannot tell us anything about why these two items may be connected. And lastly, we found the prevalence. Prevalence is one of the most important findings that cross-sectional studies can give us. Next, let's talk about cohort studies. In cohort studies, you have two cohorts or groups, and they are followed over time. Your starting point is the exposure or risk factor. I will tell you what I mean by starting point on the next slide. After you have found the exposed group, you find a non-exposed control group. Then you follow both groups over time, and then you measure the incidence of the disease. And then you can determine the relative risk. In a nutshell, relative risk asks, you were exposed? Well, here is your relative risk of getting the disease. We talk about relative risk in section 9 of this chapter. Lastly, cohort studies can be performed in a retrospective or a prospective manner. So let's say we are trying to determine the relative risk of radiation exposure to the development of thyroid cancer. You start with the exposure, which is radiation in this case. Then you find another sample population that appear the same in every way except they have not been exposed to radiation. The point of this group is to compare your findings to the general population. Then you follow both groups for 10 years. Then you simply calculate who developed thyroid cancer in both groups. In the exposed group, you have those that got the disease over all that were exposed. In the unexposed group, you find who developed the disease or thyroid cancer over all those who were unexposed. And then you can compare these risks to one another and you find the relative risk. Another way of saying this is you were exposed to radiation. Here is your relative risk of developing thyroid cancer compared to the general population. Now don't get wrapped up in the details of relative risk right now. This is taught in great detail in section 9. Just grasp the idea that a cohort study follows patients over time, starting with an exposed and unexposed group. Now what we just drew is a prospective cohort. We start with the exposure and then we followed them for 10 years. However, this study could have been performed retrospectively. This is often done by chart review of a hospital database. You find a group of people who are exposed, and then you find another group of people who are not exposed. Then look forward through their next 10 years worth of charts and see who got the disease in each group. and then you get the relative risk. So now let's talk about case control studies. In case control studies, you also start with two groups, cases, or those that are diseased, and your controls. Your starting point is the diseased, or cases. Then you find a non-diseased control group, and this prevents confounding. We talk in great detail about confounders in another section in this chapter. Then you determine who was exposed in both groups. This gives you the odds ratio. Odds ratio essentially tells you you have the disease. Here are the odds that you were exposed. Let's use our same example of radiation exposure to the development of thyroid cancer. In case control studies, we first find our cases, or those with thyroid cancer. Then we find a matching control group without cancer. Then we go back and determine who was exposed to radiation in both groups. This gives us an odds ratio. Odds ratio is discussed in great detail in section 9. For now, just recognize that case control studies start with the diseased and non-diseased control groups, and then you go back and find who was exposed in each group. So let's do a question. A group of 125 people developed giardiasis in a city. The city officials suspected a contaminated water supply at the local reservoir as the cause. They surveyed everyone in the city to identify who had visited the reservoir over the past month. Officials were hoping to find the incidence of giardiasis in their community over the past month. Would this be possible with this study model? To determine whether or not we can find incidence, we need to confidently determine what type of study this is. So in this, they described the disease, or cases of giardiasis, and they went back to see who was exposed. By surveying everyone in the city, they found a reasonable control group. So they actually found the exposure rate in both the case and control group. So this was a case control study. And with this type of study, you can find the odds ratio. However, you cannot determine the incidence. Recall which study can find incidence? It's a cohort study. Recall that cohort studies start with an exposed group and then they follow them over time to see who gets the disease in each group. And this can give you relative risk and incidence. So in the study that the city performed, which was a case control study, they cannot find incidence. Now let's talk about randomized controlled trials, or RCT. These study disease treatment. Subjects are randomly assorted into a test or a control group. And these RCTs may involve single blinding, in which the subjects are unaware of which group they're in, or it can be double blinding, in which the subjects and the physicians are unaware of either group. Double blinding is best. Now, RCTs are really good trials because they can identify causation. The problem is that they're really time consuming and they're expensive. Let's say, for example, we have 100 patients with pancreatic cancer. 50 randomly get assigned to drug X. The other 50 get randomly assigned to the standard treatment. This could be considered the placebo group. Then you measure the cure rate in the experimental group, or drug X group, and the cure rate in the control group, receiving the standard treatment or the placebo. If you find an increased cure rate in the drug group, you can attribute that increased cure rate to the drug. In other words, you identified causation. This is practically the only type of study that can determine causation. You intervened with treatment X, and you evaluated the difference in results between both groups. Now let's talk about a crossover study. This is a variation of randomized controlled trials, therefore they can determine causation. In crossover studies, patients are randomly assorted into two groups. Each receives treatment A or B for time X. Then they switch treatment and continue for another time X. So in other words, you have A, B, and then they switch. People who were on B now get A, people who are on A now get B, and each get each drug for time X. What's important to recognize is that there's a washout period. A washout period allows the previous treatment, for example, treatment A, to clear from the body before they start on the next treatment, treatment B. Now, case series are really straightforward. You just simply find your disease group, and then you follow them over time, documenting any patient responses to treatment or progress of disease or just things that they experience. These are helpful for learning the natural history of a disease or disease treatment. The last study we need to talk about are ecological studies. In ecological studies, you can measure correlation, you can find incidence and prevalence among populations, but not individuals. Ecological studies are useful for very rare diseases. And that's because you're looking at a whole population, so you're more likely to have more cases that you can examine. But you need to be careful not to apply the results to individual patients. This is called an ecological fallacy. A good example of an ecological study would be determining the incidence and prevalence of a disease across the globe. Take stomach cancer, for example. After looking at the populations, you may find that when you compare the United States to Japan, there is increased incidence and prevalence in Japan. This would be a correlation, not causation. Now let's say a single serum lead level was obtained in 1,000 participants in city A and then 1,000 participants in city B. A positive level was considered any level above 5 micrograms per deciliter. We find that 12 participants in city A were positive and 400 were positive in city B. What type of study is this? So we measured the lead levels in people in two cities. City A had 1,000 people and city B had 1,000 people. In city A, there were 12 people with a positive lead level. In city B, there were 400 people that were positive. Now, a single lead level was obtained. In other words, this is a snapshot in time. This is consistent with a cross-sectional study. And by doing this cross-sectional study, we found the prevalence in each city. We also found a correlation between living in city B and high lead levels. However, this is not causation. On this slide, we have summarized some of the most important information of the different study designs. Notice that in cross-sectional studies, you can find prevalence and correlation, which is also similar to ecological studies, which can find prevalence and correlation. Notice that in cohort studies, we find incidence and relative risk, whereas in case control studies, we find odds ratio, and we can find causation in randomized controlled trials and crossover studies. And a case series is a way to follow disease or treatment progress. And that concludes this section.